Hi, this is Brian Glass. I'm a personal injury lawyer in Fairfax, Virginia, and I'm here today with Kevin Ward of Ward Chiropractic and Rehab in University Mall in Fairfax, and we're talking about chiropractic medicine. So first, Dr. Ward, would you tell us, what is chiropractic?
Sure, yeah. By the way, thanks for having me on. Really appreciate the opportunity. So chiropractic is a specialized form of medicine that focuses on the alignment of the joints in the body. So basically anywhere where you have a bend in the body, any part of the body that moves, whether it's the neck, back, shoulder, knee, elbow, that could potentially have some alignment issues associated with it as a result of an injury. And as chiropractors, we specialize in identifying those alignment issues and restoring them to normal.
And there's a couple of other areas of medicine that deal with those problems also, like orthopedic medicine,
No doubt.
neurosurgeons. Can you tell us about the difference between what you do and what an orthopedist or a physical therapist might do?
Absolutely. So orthopedists and physical therapy, also both great forms of treatment. So an orthopedist is mainly going to deal with fractures, tumors, and infections. So if you have any problems with those, like an actual fracture of a bone or some kind of tumor or some type of infection, as I stated, an orthopedist is going to be your best bet with that. Physical therapists, they specialize in muscular rehabilitation, and they're mainly doing active care with you, meaning you're in the office doing exercises under their supervision to restore proper muscle function. And there is some overlap between physical therapy and chiropractic care, which is great. They work well together, but where the physical therapist is going to be mainly doing that active treatment, rehabilitation on the muscles, chiropractic care is mainly focused on the joints and the alignment issues.
And so the classic presentation to a chiropractor is the cracking of your back and your neck.
Exactly, right.
What else do you do?
Yeah, that's a good question. So yeah, that's what most people think of when you think of a chiropractor. You think of having your neck or back snapped or popped or cracked. But there's actually a wide variety of things we can do. So we do adjustments, or we also call it manual therapy, where we're mobilizing the joints. Sometimes there is a cracking or a popping associated with that, which is what we're best known for. So we do that aspect of it. And then we also do, well, first of all, there's many different types of chiropractors that specialize in many different types of things. But in our office, we are focused on musculoskeletal issues mainly. So we do the adjustments, we do some active rehabilitation, kind of similar to physical therapy, and we also do different modalities like ultrasound and electric stimulation to help relax and heal muscle tissues.
And who should be coming to you? Should anybody with back pain or neck pain be coming to you, or are there specific things that would make somebody think, I need to call a chiropractor and I need to get in and have Dr. Ward evaluate what's going on with me?
Yeah, it's a good question. Joint pain is usually why people come in to us initially. So yeah, if you have a non-surgical joint issue, that is a good candidate for chiropractic care. So if you have back pain, shoulder pain, and hot lights and cold steel, you don't want that in your future, meaning surgery. Chiropractic care is something that could potentially help you. Now, chiropractic care certainly can't help every case. So, that's why when you come in our office, we take a full history, and I know we're going to get into that a little more later, but yeah, potentially if you have a joint problem and you don't want to do drugs or surgery, or maybe you want something in addition to just taking pain medication to actually fix the problem, that could be a good candidate for chiropractic care potentially.
So you brought up something interesting. Chiropractors don't prescribe medication. Is that right?
That's correct. Yep. In Virginia, chiropractors, it's, by choice, chiropractors have elected to be a non-drug, non-surgical alternative to restore the body to natural function without bringing in these outside agents. That doesn't mean in some cases drugs aren't necessary, because in some cases they absolutely are. But as a profession, that's correct. Chiropractors do not prescribe drugs or narcotics or anything like that.
And so if you thought you had a patient who might benefit from some kind of neurological drug or something like that, would you send them back to their primary care doctor to be evaluated for that?
100%, yes. So there's lots of, first of all, as a healthcare model, everything works better if the doctors all work together. And we view ourselves as a collaborative piece of the patient's healthcare team. So certainly we have a network of professionals that we refer to, and we may co-manage a case with a neurologist or a primary care physician or an orthopedist or a physical therapist or a surgeon, or we may just simply refer to them if it's, for example, if someone came into our office and they had a fracture, we would refer that out.
Right. I imagine the last thing you want if you've got a fractured vertebrae in your neck or your back is a chiropractor manipulating
100%. Yeah, that
spine.
is an absolute, we call it a contraindication to an adjustment. So if you have a fracture, you do not want that manipulated, no doubt.
What can somebody expect the first time they come into your office?
Right. Yeah. So the first time you come into your office, we really want to know your story as far as why you're coming in the office. So we have a short amount of paperwork. We try to keep it as short as possible. And then we take a detailed history as far as why you're coming into the office. And chiropractic care is about connecting different pieces of the puzzle together. So we're a little different than maybe some other healthcare professionals that kind of, focus on one area. We're going to look at the body more holistically. And a lot of other healthcare professionals do that as well. But, we're focusing on, the entire body, what's causing this problem, because the back can affect the hip, can affect the knee, and so on and so forth. So we're going to talk about everything that's going on. And then we're going to do a detailed exam, which will include range of motion, muscle testing, orthopedic testing, and in some cases diagnostic imaging when necessary. And then if you're a candidate for chiropractic care, we'll talk to you about your treatment options and what your treatment plan would look like. And then if you choose to start care at that time, we would start. And then also, if you need, like we had just talked about, if you need to see another provider, we'd get that working as well at that time.
And how can people find you? How can they become a patient of yours?
Yeah, it's a good question. Thanks for asking it. So they can check us out on the web. Our site is wardchiroandrehab.com. We also have a Facebook page. And, of course, you can call our office as well.
All right. Well, thank you for coming in today.
You're welcome.